Good evening, everybody. I'm Susan L., Vice President and Executive Director of the Foundation for Barnes Jewish Hospital. Welcome to all of you who are here in person and to those of you who are joining us virtually. We have probably the largest audience that we have ever had for one of these programs, especially online since COVID. So thank you for joining us for this late summer edition of the Foundation's Leading Edge Medicine series. Our Leading Edge Medicine series is an exclusive opportunity to hear firsthand about the incredible innovation and discoveries and programs happening right here in St. Louis because of your generosity. The St. Louis philanthropic community is so truly special. Your compassion, generosity, and genuine desire to address our community's needs through your giving is unmatched, and it's always inspiring. On behalf of our patients, our families, our community, we offer our heartfelt gratitude. You're making a world of difference every single day in our community and beyond, and the Foundation is honored to partner with you. The Foundation remains committed to improving health equity as part of our mission to enrich and save lives. BJC and the Foundation partner with groups that make up the fabric of under-resourced neighborhoods and is striving to bring a holistic approach to improving physical, mental, and financial well-being. We cannot improve community health without the community and strong, authentic partnerships. You're going to hear more about that tonight. It's in our DNA. Now, if there are any geneticists in the room, it's in our DNA to do this, thanks to the former Jewish hospital that specifically designated funds to serve neighbors and neighborhoods facing the greatest health disparities in our community. Over the years, we have continued to build on that tradition at the Foundation. I'm excited about the direction from BJC that gives us guideposts and strategic priorities in the realm of community health improvement. The Foundation has been proud to support BJC Community Health Improvement since its inception in 2021. We made a commitment to become a catalyst for community health and vitality by helping to co-create and amplify effective community health solutions to help eliminate longstanding health disparities. But BJC cannot do this work alone or in a silo, and that's why BJC partners with community organizations to co-design and amplify all our efforts to improve physical, mental, and financial well-being. And with your help and the expertise of a passionate, dedicated team, we envision a thriving region where all people have an equal opportunity to live their healthiest lives. We're honored to partner with Christian Hospital Foundation, Missouri Baptist Hospital Foundation in supporting BJC's ongoing community health improvement work in the city of St. Louis and North St. Louis County. Tonight, you're going to learn so much more about the exciting progress we're making in community health from Bob Cannon, as well as from our featured speaker, Deidre Griffith. Bob Cannon is Group President for BJC Health System's East Region, where he oversees 5 hospitals in the St. Louis region, as well as Barnes Jewish College Goldfarb School of Nursing. His responsibilities also include, as if that wasn't enough, community health improvement, government relations, and capital construction activities across BJC. Bob was instrumental in the launch of BJC Community Health Improvement and continues to work closely with the team to grow and expand the many initiatives into action. This evening, Bob will share a little more about how BJC Community Health Improvement came to fruition before he introduces our featured presentation and question and answer session. So, join me in welcoming Bob Cannon.
Thank you, Susan. The Foundation staff was good enough to provide me with some prepared remarks, and I'll do my best to stick to some of them. But there's a few things I want to add on my own as we go through this. But some things to know. You know, this is just such a wonderful evening, a wonderful way to come together, and every opportunity I have to thank the Foundation and to thank the community for the support that you provide us at BJC and our mission, our unwavering mission of providing extraordinary care. You know, we serve a lot of communities, rural, urban, suburban, with a lot of diverse populations, of diversity of every kind in what we do. In about 2018, BJC Healthcare embarked upon a renewal of our strategic plan and our strategic directions for the health system and for the community. And as I was walking in this evening, Rich McClure reminded me that it was in this very building where, in presenting that strategic plan, a major component, a pillar of this strategic plan was to elevate the prominence of community health improvement in our mission for BJC Healthcare and in our commitment to the community. And in advancing that recommendation as management, the full-throated and wholehearted support from our governance, from our leadership of BJC and our board, to embark upon this most important work in the community in a new and different way. We left this building that day with such energy, such enthusiasm, and such commitment. And the foundation was our partner from the very start, because we knew we would need a catalyst to really impact the community in ways that it needed. And to sort of live up to the 100 years of backdrop of care for the underserved in dealing with the profound racial disparities of health that we have in our community, and indeed the profound disparities in income that lead to such terrible, terrible implications around social determinants of health. And this is what our caregivers and this is what our teams see every day. And so the ability to stand before you tonight, some years later, and be able to introduce Deidre and to be able to celebrate with you the dedication, the determination that the foundation has in making possible the progress that we all intend to achieve is truly remarkable. As we got started on this work, many of you know Jason Purnell, and Jason was one of our early influencers and effective leaders in bringing together disparate actions from across BJC and programs from across BJC into a more coherent whole. And as Jason moved on to the McDonald Foundation, we found ourselves in the position and with the need to recruit an extraordinary leader. And in that search, there was a remarkable candidate pool of very talented leaders from across this region and indeed from across the country who recognized that our commitment to community health improvement was indeed genuine and indeed lasting. And in that process of going through that selection process, I learned so much from all the candidates, but one stuck out in particular, and that was Deidre. So let me tell you a little bit more about her. Before she joined BJC, Deidre was Vice President of Programs for the Alliance for a Healthier Generation, which is a national nonprofit that's dedicated to empowering youth to develop lifelong healthy habits. Prior to that role, Deidre led community health improvement initiatives across 7 of the hospitals for SSM Healthcare, so she knew health systems well. She also served in community health leadership roles at the Missouri Foundation for Health, Washington University, and St. Louis University. She holds a master's degree in public health from St. Louis University and a bachelor's degree from Loyola University in New Orleans. She has been recognized as a fellow in the Terrence Keenan Institute for Emerging Leaders in Health Philanthropy and is a past graduate of Focus Leadership St. Louis. I know some of you in the room are as well. When you kind of put all that together in terms of Deidre's career map, you really have a talented leader who has been a real advocate for our community, embedded in the community, someone who's been a researcher, someone who has deep expertise in grants and contracts, someone who has worked in philanthropy successfully. And all those things are sort of wonderful in the resume and were very influential as we were evaluating our candidates. But there's more. The things that I have learned and enjoyed the most with Deidre are her ability to build successful teams and her persona as an inspiring leader. Over the last year, so Deidre's been with us a little more than a year now, and when I look at that, it's amazing it's a year. I mean, number one, it seems like I've known her forever, but the other part of this is just how much has been accomplished. But really went to work to build a strong team to support our new initiatives. And there are members of the team here, so anybody who's community health improvement team member with Deidre Foundation, raise your hands. Come on, yay! Here we are. This is a wonderful team that I have the privilege of interacting with from time to time as well, usually involving a happy hour of some kind, but it is really all good. But as Deidre shows and demonstrates her dedication to the mission and the sense of purpose, there's really so much more. One of the things is I continue to learn from her every time I meet. Deidre, you just have such a wonderful and approachable style. We deal with very serious issues, yet your leadership style is to approach those with optimism and determination. And that allows us all to rally behind the importance of the work and the impact that we're having on the community. So tonight, you will get to hear from Deidre. She will share some of the innovative solutions that she and her team are co-designing in the community to address these important issues of health disparities. After Deidre, we'll hear a bit more from Dick Miles, our former chair of the foundation here and emeritus board member, who in his own right has made such an important set of contributions and impacts in our community. So without further introduction, Deidre, I'll welcome you to the podium and say thank you in advance. Thanks, everyone.
Just gonna get myself situated here. Okay, well, I'm overwhelmed. I was not quite prepared for that welcome, and I just wish I had time to elevate all of your wonderful attributes and qualities as a leader in the manner in which you have guided me and the team over the last year for me and since inception for the team. So thank you very much. I appreciate it deeply. So good evening, everyone. Thank you for being here. Thank you for braving the heat. It is very hot outside. I was sweating profusely before I left the house. This shirt actually shows a lot. My daughter was like, "Mom, you gotta like put something on that." So I had to like do a little finagling. But I am here and just so thrilled to be with you all tonight. So again, as Bob mentioned, I'm Deidre Griffith, Vice President of Community Health Improvement. And I'm honored to be here tonight to share and celebrate with you the work of BJC's Community Health Improvement. I want to start by acknowledging some folks without whom I would not be where I am, and without whom BJC's Office of Community Health Improvement would not be where it is. I want to start by thanking my family, my parents who grew up in the Carr Square Village Public Housing Complex of St. Louis City, zip code 63106, currently ranked one of the lowest resource zip codes in all of St. Louis City. But my parents demonstrated to my two sisters and I what could be accomplished through dedication, education, consistency, and faith. I also want to thank my husband, who has been one of my biggest champions of my public health career every step of the way, and my two lovely teen daughters who are starting to envision and define their own careers as they are at that age. Last year, during a BJC leaders meeting, we had a wonderful, inspirational speaker, Mr. Ryan Leak, who said to the audience, "Each one of you has that person who took a chance on you, who hired you and then went like this." So for me, that person is Dr. Beth Baker from St. Louis University, I believe Beth is here tonight, and I want to thank you, Beth, for taking a chance on me all those years ago. But I was fortunate to have the guidance of so many talented leaders, and I want to thank all of my earliest public health mentors and teachers who showed me the ropes and the way, ensuring a strong foundation to my public health career. Again, Dr. Beth Baker from SLU, and Dr. Matt Kruder, Dr. Vetta Thompson, Dr. Ross Bronson, and Dr. Deborah Hare-Joshu, all from Washington University, and Dr. Susie Nanny, who unfortunately is no longer with us. You all are public health greats, and over 20 years later, I am still in awe that I had the opportunity to work so closely with such distinguished and accomplished public health researchers, leaders, and innovative thinkers. Thank you for investing in me. Some of them are here, some of them are in line. And of course, BJC leadership. There are so many BJC team members and department I would love to thank, but that would take my entire time here. As you know, we are a very big organization. But I especially want to thank the board of directors and leadership from the Foundation for Barnes-Jewish Hospital, Dr. Mahendra Gupta, Dr. John Lynch, Susan L., Dr. Katie Henderson, Eric Barkley, and Derek May. Our BJC Health System CEO, Rich Leikwig, BJC Health System President, Nick Bardo, and BJC East Group President Joan Magruder, and of course, my boss, Bob Cannon, who you heard from earlier. Thank you, Bob, for your kind words and for your authentic and visionary leadership of BJC and community health improvement. And my CHI team, Bob had you all raise your hands. Go ahead and do it again. I'm so thankful for each and every one of you, and I want to give a special thanks to my dynamic leadership team here tonight, Danisha Bohannon, Christopher Nolan, Martha Bisking, Nicole Cosma, and Karen Bacon, who couldn't make it. And a special thanks to Emily Kreiser, my right hand in the development of this presentation. And I believe Denise is here as well. So thank you so much for being here. Thank you to all of our community partners who have trusted in BJC, many of whom, again, are here tonight or online. We are incredibly grateful. And as Bob mentioned, I also want to thank my friend and predecessor, Dr. Jason Purnell, for his critical role in the launch of BJC's Office of Community Health Improvement and all that he continues to do to ensure more inclusive economic growth for our region. Thank you to all of you. So before I really begin digging in, I want to just preface that sometimes you're going to hear community health improvement, sometimes you're going to hear CHI. CHI's a little shorter, just know it all. It all means the same. So again, we're here tonight to celebrate the deep investments and community collaborations that have shaped the current state of BJC's Office of Community Health Improvement. But we're also here to envision together a new story, a new narrative, where all in St. Louis have the opportunity to be well. But we know that our ability to be well is driven by the social and economic and environmental factors of communities in which we reside. Engaging in healthy behaviors are essential. We know that. Yet, the safety and social context of our communities and neighborhoods are major drivers of food, education, healthcare, and economic opportunities that are made available and accessible in communities. And this is the root of racial, health, and economic disparities. But how might we create a new story, a new narrative, where all in our region have the opportunity to be well? While we know there is still much work to be done, reality is that we as a community, as a region, as a country, have come a long way already. Does this building look familiar to any of you? Okay, if you know, then shout it out. What is it? That's right, that's right. Designed by architect Sir David Frank Adjaye, the National Museum of African American History and Culture officially opened to the public in January 2016. The National Museum of African American History and Culture is the largest museum dedicated to African American history and culture. 350,000 square feet, 10 stories, 5 below the ground and 5 above. 40,000 objects in its collection. And in 2022, It was the most visited Smithsonian Museum, welcoming over 1 million visitors. And it was the 8th most visited museum on the list of most visited museums in the United States. It's truly a modern marvel, encapsulating the best and the worst of the African American experience in America. There's a certain flow to the museum, and if you don't follow the flow as museum officials advise, it can make the difference of you leaving feeling inspired and full of hope, or leaving heavy-hearted and feeling that the worst is still ahead. On my first visit to the museum, just a few months after the grand opening, I sadly took the wrong route. Yes, I did. I did not encounter a guide. I don't know why. And I started my journey on the upper floors of the museum, the culture galleries, where there are vibrant displays of African American art and music and elaborate tributes to African American heroes of science and sports and the culinary arts. I was overwhelmed with joy and inspiration. However, I ended my journey on the lower level history gallery. I see your face, Risa. I did. I ended my journey on the lower level history galleries, where you encounter artifacts of the slave trade and slave life, like the bilbos, those iron restraints or shackles that were used to restrain slaves on slave ships, and historic drawings, or blueprints, if you will, of the slave ships, showing the depth of strategy and pre-planning that went into calculating just how many slaves could be packed into one single ship. Some ships went over maximum legal capacity by as much as 80%, ensuring death and destruction to countless lives, long before they ever reached the shores of America. And there are relics of slave cabins and tools that were used by slaves in the backbreaking work of sugarcane harvesting and processing. This is not how anyone wants to leave the museum. And it's also not how any of those visionaries and leaders want you to leave the museum. They want you to leave inspired, because despite it all, it has been proven time and time again how resilient African American people and communities are, as evidenced in the upper level culture galleries. So we want you to leave here tonight inspired, but also ready to do even more, because while we have come a long way, we cannot take our foot off of the accelerator for health equity. We have to stay on the accelerator, because we know that Black babies in our region are 3 times as likely as white babies to die before their first birthday, and that Black women in our region are 2 to 3 times likely to experience a pregnancy-related death than white women. We have to stay on the accelerator, because mental illness rates, while highest in St. Louis City among all races, they are even higher for Black residents at a rate of 3 times that of whites. We have to stay on the accelerator because we know that St. Louis continues to rank as one of the top 10 most segregated cities in our entire country. And we have to stay on the accelerator to ensure that all people oppressed through policy and systemic racism are assured the strategic investment, resources, and empowerment that they have earned. So BJC Healthcare, as you heard from Bob earlier, has a long-standing commitment to improving the health and well-being of the communities we serve. Over the past 6 years, BJC has deepened this commitment, first in 2018, when we began the journey of creating a system-level office of community health improvement, and again in 2020, when the department was formally launched. CHI's inaugural strategic plan was completed in 2021 and provided guidance for our work throughout 2022 and 2023. Our evolution continues, most recently with the strategic planning refresh process, of which we are in the final stages. We are very excited about that. And this has helped us identify strengths and areas of opportunity so that we can further refine our approaches to have the greatest impact on the health and well-being of the communities that we serve. My focus today will be on sharing our current and past work, but I encourage you to stay tuned for our exciting next chapter. As our work continues to evolve, so too does the framework for how we do our work. The strategic planning refresh process has helped us think anew about how CHI operates, and we've created a visual, as you see here, to help capture this evolved thinking. At the center is community health improvement, not only our team, but our North Star, the health and well-being of the communities that we serve. Integral to us achieving this work are our internal and external partners and collaborators. They are essential to our ability to deliver on our strategic initiatives. Collectively, these initiatives, in addition to the support that individual hospitals and departments provide to communities, roll up into BJC's community benefit investments. And this work cannot be sustained without philanthropy or supportive policy environments. These critical operational functions keep the work moving forward. Across our work, community health improvement plays a unique role that distinguishes us from other BJC teams and resources. We are almost entirely focused on prevention and working through and in partnership with community organizations and stakeholders to have impact. The roles that you see mentioned here, screening for needs, providing education, increasing access to services, making connections to resources, while these require different skills and capacities, making for a diverse CHI team, what they have in common is the emphasis on prevention. Prevention. This is the sweet spot for community health improvement. And as you'll see in the next slide, it's reflected in our strategic focus areas. We distinguish our work in two main categories. Core strategies are those bodies of work that have come out of our strategic planning efforts. So they have been identified by key stakeholders as the most pressing areas for BJC to provide support. We currently have 4 core strategy areas: anchor strategy, diabetes and healthy food access, infant and maternal health, and school health and wellness. Each focus area has a devoted team, key community partners with whom we work, and annual goals and metrics against which we measure our success. Responsive approaches are those bodies of work that emerge as community needs unfold. This work is more flexible, and it is intentionally so, given that we need to be able to respond in real time to any need arising from our communities. Currently, we are working in 3 primary areas in the responsive portfolio: violence prevention, community health screenings, and housing insecurity and mental health. So I want to now walk you through our strategies. And as I do so, I'll be featuring 1 or 2 of our amazing collaborative community partners. Our Anchor initiative is focused on addressing long-standing social and economic disparities that drive poor health outcomes. By leveraging BJC's economic power to support community and economic development and advance diverse business growth, we are creating more opportunities for all people to thrive. We are doing this through 3 primary activities. The first is supporting the growth of diverse suppliers and contractors. The second is pursuing impact investments in partnership with community and financial institutions. And the third is leveraging volunteerism as a means to supporting efforts in alignment with our core strategies. Through our Anchor strategy, over $350 million has been leveraged collectively for community impact over 3 years as a sort of snowball effect to BJC's Anchor investments. And in 2023, we expanded our Live Near Your Work employee home ownership program to include North St. Louis County for the first time in the program's almost 30-year history. Recent data show that 78% of program participants receiving funding were first-time home buyers, and 40% have purchased in our newly expanded geography of North St. Louis County. Obviously, we are thrilled about that. We also launched a volunteerism program for BJC employees in order to leverage BJC East's 33,000 strong employee base in support of mission-aligned nonprofits. The work that we do would not be possible without partners like the St. Louis Community Credit Union and WePower. We are proud to partner with financial institutions like the St. Louis Community Credit Union, which believes that banking is a public good. One of the largest Black-owned credit unions in the nation, St. Louis Community Credit Union provides adaptive solutions to meet people where they are in their financial journey and equip them with tools and knowledge to receive and achieve their personal goals. CHI is a proud partner with St. Louis Community Credit Union on several projects, including most recently as an impact investor with Scale Up SCL, a new low-interest loan fund for small businesses and nonprofits that need access to capital in order to grow and scale. As noted earlier, business equity is a primary driver of wealth for Black Americans. And we are also proud to partner with WePower, an organization that envisions a future where systems are accountable to powerful communities that have been historically oppressed and nurture our freedom, well-being, dreams, and joy. WePower's vision is brought to life through its innovative approaches to supporting business growth and community wealth. They not only provide access to financial capital, but they pair that with social and intellectual capital in the form of connections and business coaching. BJC is proud to be a partner with WePower in these efforts. First, as an anchor investor in its $1.5 million fund that is investing in Black and brown entrepreneurs in North St. Louis, and more recently in collaborating on several business development efforts, including their 2 recently launched Business Accelerator programs. Diabetes and healthy food access. In our diabetes and healthy food access strategy, CHI is focused on addressing the underlying causes of chronic conditions that increase community members' risks for developing a chronic condition like diabetes and make it harder and more costly to manage that health condition. We are pursuing several approaches that elevate healthy eating and active living as evidence-based strategies for improving the health and well-being of communities that have faced decades of disinvestment. For several years, our team has supported the development and delivery of food as medicine programs, which focus on specific disease conditions and populations. In 2023, we expanded a successful food as medicine medically tailored meals program, which showed an average 2-point decrease in A1C blood glucose numbers for participants. And we supported 6 new community-based healthy food access points in communities with extremely low access to healthy foods. One partner by our side, helping us carry out this work, is Oasis, St. Louis Oasis. Oasis is one of the nation's leading providers of programming for older adults who seek to continue learning, engage socially, and improve health and wellness behaviors. For nearly 40 years, Oasis has been an innovator in supporting community health, and we are proud to collaborate with Oasis in several areas. They have been instrumental advisors and partners to our team as we build out our playbook for BJC's Food as Medicine programs. They are also critical partners for delivering healthy eating and active living programs in partner library, community center, and recreation center sites. And their deep knowledge and expertise in delivering prevention, education, and community-based settings makes our work that much stronger. The other partner I'd like to highlight is HOSCO, North St. Louis Food Hub, an organization that actively works to combat food insecurity and promote equitable access to quality food. We are so proud to have the opportunity to partner with the North Sarah Food Hub. Through our collaboration, we have been able to deliver locally grown, medically tailored meals and meal kits to patients who have participated in 2 of our Food as Medicine programs. In partnership with North Sarah Food Hub, we have not only helped patients manage their diabetes by reducing their A1C numbers, but also by ensuring reliable food delivery, we have enhanced their access to nutrient-dense foods. And by providing healthy recipes, we are able to inspire patients to maintain balanced diets long after the program has ended. Community Health Improvement's infant and maternal health strategy is focused on improving health outcomes for Black moms and babies. Over the past several years, we have focused on increasing access to doulas, who provide non-medical companionship and support throughout the pregnancy journey, as research shows that how increased access to doulas can improve a range of health outcomes for moms and babies, including lowering healthcare costs, reducing C-sections, decreasing maternal anxiety and depression, and helping to improve communication between lower income, racially and ethnically diverse pregnant people and their providers. Over the past 2 years, our efforts have been focused on several priorities, including hosting educational workshops for our clinicians and families to help expand knowledge and awareness about doulas and the role they play in ensuring that women and their families have affirming, healthful birthing experiences. More recently, we have helped launch a fund to support families in receiving doula services from one of 3 community-based doula organizations that serve Black moms in the St. Louis region. In 2023, we provided doula education training to 156 BJC clinical team members across 4 of our hospital sites. One of our key partners in this work is Jama Birth Village, a community-based organization that provides doula care services for BIPOC pregnant people who are both low risk and high risk for both medicated and unmedicated births. Jama Birth Village is based in Ferguson, Missouri, and provides pro bono work and doula scholarships for moms who are low income or unemployed. BJC has partnered with Jama Birth Village to co-create our doula education workshop series. And Jama Birth Village is one of 3 partners participating in the community-based doula organization Doula Fund project that I've referenced earlier. We look forward to working alongside partners like Jama Birth Village to further advocate for policies that are more accepting of doulas and advocating for reimbursement of doula services by Missouri Medicaid. As part of our school health and wellness strategy, CHI is implementing several strategies to advance equitable health and education outcomes for area youth. I'm getting a little dry, so sorry. And to increase access to programs and community-based services that address behavioral health needs, as well as literacy-related needs. Over the last several years, our team has established 6 community wellness hubs designed to be places of respite in communities that face the starkest disparities and inequities. We partner with known and trusted community partners, including recreation and community centers and libraries, to provide wellness programs during out-of-school time for youth and the adults in their lives. We also have a full-time educational specialist who meets one-to-one with community members and provides referrals and connections to community-based behavioral health services and health-related social needs. In 2023, our CHI Schools team delivered over 300 wellness programs on critical issues like social-emotional learning, nutrition, physical and mental health, wellness to nearly 8,000 residents across our community hubs and 30 schools in communities that have low access to quality education and healthcare. One partner that helps us carry out this important work is the Youth and Family Center, which supports residents in St. Louis and parts of Illinois in achieving their full potential. Their mission is for every youth, senior, and family to have the necessary resources to live healthy, stable, and independent lives in a safe and vibrant community. We launched a community wellness hub at the Youth and Family Center earlier this year. Through this hub, we help to connect those they serve with community organizations, provide prevention education programs as part of Wellness Wednesdays, and provide support for youth and families on-site health clinic. Our work with Youth and Family Center continues to evolve, and in the future, we look forward to delivering other programs and resources to support their community's health and well-being. Another partner I'd love to highlight is the Collective SDL, a Black-owned yoga studio committed to improving the health and well-being of Black communities in St. Louis. The Collective SDL's mission is to provide culturally tailored practices, programs, resources, and services that promote improvement of physical and mental health and wellness among Black communities in St. Louis. The Collective SDL was the first partner organization in our Community Wellness Hub initiative, providing yoga at 3 of our St. Louis County Library branch partner locations in North St. Louis County. And currently, the Collective provides weekly yoga at 2 of our wellness hubs in St. Louis City Rec Centers, Marquette, and Wohl. During the year, yoga is offered in the early evening, and during the summer, yoga is offered during summer camp. Our responsive initiative strategy is our newest and still undergoing some refinement. However, it plays a key role in our strategy because it is designed to respond to stated needs of the community and how those communities may change over time. Its purpose is to ensure that BJC remains flexible and nimble to issues emerging from the community that may fall outside of our core strategic framework. We know that in St. Louis, we have an ever-changing ecosystem of social service partners, health systems, community-based organizations, coalitions, and governmental and political drivers. While these entities may differ in their priorities and approaches, they are often mission-aligned with shared goals around addressing the root causes of inequities and creating more equitable systems. As emerging community needs shift in this ecosystem, BJC must be positioned to respond. 3 primary areas of current focus under our responsive portfolio are community health screenings, housing insecurity and mental health, and gun violence prevention. Some of our partners in the responsive portfolio include St. Patrick's Center, LIV Live Sober Living, Beyond Housing, the Bullet-Related Injury Clinic, and our Life Outside of Violence hospital-based violence intervention program in partnership with Washington University and SSM Health. As you all can see, we at BJC have been very, very busy. We are so proud of what we have accomplished to date, but we know that there is still so much to do. And we intend to double down on our community-centric efforts and initiatives as we head into this next phase of our strategy. We hope that everyone here and online will also double down on your involvement as well. We cannot do this work without our partners, and we welcome strategic partnerships and collaborations to further advance health equity in our region. We also know that advocacy is a powerful tool to drive change. So please lend your voice, lend your power, lend your powerful voice to influence legislation that positively impacts health and well-being of families in our communities most in need. And of course, you can always give. Many BJC health improvement programs are made possible thanks to strong partnerships with community organizations and generous donors like you who make philanthropic gifts through the Foundation for Barnes-Jewish Hospital. From an initial leadership gift and continued support from the Goldstein Family Foundation, to many donors who have joined BJC and the Foundation for Barnes-Jewish Hospital to support this work to date, including Cigna Group, Foundation, AHEAD, Dell Technologies, Spire, Healthy Blue Missouri, Ameren Missouri, Missouri Department of Economic Development, the Foundation for Barnes-Jewish Hospital Board of Directors, and many, many more. Thank you. Thank you for joining BJC, our community health improvement partners, and the Foundation for Barnes-Jewish Hospital to improve the health and well-being of our neighbors and our community. Thanks to each of you for the work that you do every day to drive change. And for coming out tonight in this heat advisory. I'm sweating a little bit, I don't know if you guys are. But thank you for coming out to support and to learn more about BJC's commitment to community. And that concludes my presentation.
Any questions? I have one. Two right next to each other. You guys are Hello.
Hello.
My name is Diane Kahneman. I'm one of the board alumni members of the Jewish Hospital School of Nursing. But I wanted to thank you for the wonderful presentation. And my question is, what is the collaboration like with St. Louis City government or St. Louis County government as far as the initiative programs that you're working with?
Well, two of our hubs, the Wohl and Marquette Centers, are owned by St. Louis City. So we work very closely with our city and county governments. I myself have a strong relationship with the health directors at the St. Louis City and St. Louis County, and we're sure to stay in communications about the evolving needs of our communities. So we have connections, they're part of our portfolio, and we surely have more that we need to do together, and we will be working towards that as we move forward.
Thank you. And I'm Penny Berry. I'm also on the Alumni Advisory Council with Diana. In the early 2000s, we had an outreach program through Barnes Jewish and WashU for screening for osteoporosis, frailty, and depression that lasted 10 to 12 years, I would say. I noticed you don't have anything for the elderly at this point in time. I would like to see that expanded. And also, as a member of the Alumni Advisory Council, there are a lot of retired nurses. And retired nurses like to volunteer also. So that's a tap that you might check on.
Absolutely.
Also, Dr. Angela Clark is here this evening. And she is president of course, Barnes Jewish College at Goldfarb School of Nursing. And I'm sure that she would be very interested in students' outreach program with the community. So you might approach Dr. Clark.
Oh, where do I start? First of all, thank you for your comment and your passion, and we love our nurses, and we love Dr. Clark. And just for everyone's awareness, Dr. Clark and I know each other very well, and we also have a cadence where we connect and talk about ways to get her team, her nurses in communities. We have a lot of things in motion right now. And yeah, of course, we would love to focus on so many different demographics and populations and geographies. But of course, we are of limited resources and cannot boil the ocean, and we wanted to prioritize. However, I am very proud of the partnership we have with Oasis, because as you know, that is an organization dedicated to seniors. And we have leveraged Oasis to help build out our youth literacy program, as they just do wonderful work through their tutoring engagement, and they have a large volunteer base. I'm sure many nurses and many other retirees. So we do have a connection there, but your point is well taken. Yes.
I'm Dr. Heron with Hosco. Oh, thanks. I'm Dr. Heron with Hosco, one of your partners. My question is, around the areas of screening, community screenings, how are you measuring the impact of those community screenings? How do you know that it's making the type of difference that you're setting out to make?
Yes. Very good question. So first of all, the community health screenings, as you noted, is incorporated now into our responsive portfolio. We were very fortunate to have a wonderful team of nurses, some PRN nurses, who go out and do not only screenings for our community members, but also for employees and other employers. So this is an area of opportunity for us. Now that this team is under community health improvement, they weren't always under community health improvement, but you just seeing them baked into our responsive strategy today is a step forward, right? We are now have a place, a home, and we are counting the number of screenings that they do, and they are, as of this year, incorporated into our dashboard, our metrics that we are capturing. Now, right now, it's kind of processed, it's numbers, but to your point, we've just hired someone who's very strong in evaluation and learning, and her task is to do just that, to help us better understand the impact and the data that we're seeing and better tell the story of our impact. So we're on the right path. We are not there yet.
Online, if that's okay with you, that they sent in to us. But would you mind speaking to what success looks like for you and for our community as it relates to BJC community health improvement in the next 10 years? I'm sure that's a very loaded question.
That's real loaded, but I appreciate the question. I am going to kind of stick to something that's kind of standard. Obviously, we would love to work ourselves out of a job. We would love if our team didn't need to be so big. We would love if we didn't need to focus on so many strategies. We would love if, again, the need just wasn't there. The success is for us that the data begins changing, disparities are eliminated, and we are all having a good life, able to obtain our healthiest lives possible, no matter where we live, no matter our race. So that would be success.
Thank you very much. Any other? Yes. Two more. These will be our final two, and then for those in person, we'll be able to continue after remarks from Dick Miles.
Hi, Deidre.
Hi, Kendra.
Kendra Kopanis from Generate Health. I really appreciate the investment in maternal and infant health. It's really important and critical. I just wanted to ask you, reference that there is some learnings and refresh happening. Is there anything you can share regarding what we can anticipate moving forward?
We're going to keep you on pins and needles. I don't want to get ahead of the system board, right, Bob? But I can tell you it's been a very robust process. It has been months. I don't have the numbers in front of me. Many stakeholders involved, many team members involved, those who have been closest to carrying out the work. And, it's driven by data. So, no, I cannot share exactly, Kendra, what we'll be doing. But we will not be pivoting. We will be doubling down on our infant and maternal health work, and it will continue to focus on those experiencing the greatest health disparities, Black women and babies.
Hello, everyone. My name is Ebony Hooper Boateng. I'm actually here from St. Louis County, Department of Public Health.
Yay!
But I had a question just in terms of like the priority areas that you outlined today. Just from like a bigger process standpoint, how often are those like revisited or that they may potentially change based on what's going on or the data and things of that nature?
So you're getting a little bit into our refresh process. So the last plan went 2022 to 2023, and so obviously we needed to re-up that and refresh. My hope and goal is to build out a longer plan this time so that we are assured that we can continue moving the needle on each of our strategic areas without disruption. Right, because it is a lot to pause. We're still moving the work forward, but we're also kind of pausing to do all the conversations and the re-strategizing and the data. So it does cause a bit of a disruption to do this. So my hope is that we can go multi-year this time, and so we're still pretty new, and so we don't have that. We're not in that kind of cycle just yet, I guess.
Thank you so much, Deidre. Another round of applause for a wonderful presentation.
Thank you all.
We'd now like to welcome Dick Miles. A little housekeeping item for those of you in person. If you parked in the garage and have a ticket with you, that is automatically validated. So you just need to keep that with you and use it to exit the garage, but you should be all set. No additional stickers.
And if you lost your ticket, I found one, so come.
All right, thank you, Dick.
Thank you. I'm really pleased to be here tonight. I was the board chair of the foundation for the last 6 years. I remember back in 2017 and 2018, the hospital and the system was talking about this move to deal with the disparities in North City and in other areas of our community. And I was shocked when I looked at the statistics. And I think we all should be somewhat shocked. We're improving those, and I think this is the right way to go. But we shouldn't, with all the resources we've got in our community, to allow the disparities to continue on as they have for a long time, despite a lot of really hard efforts from a lot of people. This is really one of the most important things that the hospital can do, and I really am proud of Rich Lakewig and Bob Cannon and others who recognized that this is, it's not all building great buildings and all the research that we do, but it is going to the people that we serve on a daily basis and improving their lives and minimizing the discrepancies that we've got so that we don't live with them and we live all in a much healthier environment for everybody. I think very important that everybody at BJC feels that everybody in our community deserves extraordinary care, and it's not has a right to, it's deserves. And I think there's a lot of things that are going on, certainly at the foundation and in Deidre's operation, dedicated to that our clients deserve appropriate health care. And we've got a ways to go, but we're getting there. And there's nothing more important as far as I'm concerned than these programs for those that are facing these disparities. I hope that we publicize the disparities, not in any way other than to let people know and publicize our successes, because I know we've got some and we're going to get more. And but I think the more people recognize what we're doing and why we're doing it, the more support we'll get in the community. And I think having the approach with the community and the things that we're building up in these are all very, very valid programs. And I think that we're going to see great success for them in the future. The foundation has been very thrilled to be involved in this journey, and it is a journey. We've got some people on the foundation staff that work very closely with Deidre's staff, and we're going to continue to do that. I'm also the board chair of OASIS, so I really, and I know that Marilyn Mann is really happy to hear these comments, because we really feel that working with the hospital and meeting these needs of older aged individuals and the younger ones through the tutoring programs is extremely important and goes along hand in hand with all of this. We're grateful to the Foundation's partnership and to our donors for making such a wide variety of progress possible through the Community Health Initiative program. I'm very proud of what Deidre has put together and the seamless transition that we're going through, and how we will be measuring success in the future. So I think it's going to be terrific. Deidre had a laptop. I've got paper. So I hope that you learned something tonight. I hope we all did. I hope we can take it back and really continue the conversation both after this meeting, because please stay with us if you can and enjoy some refreshments put on by the foundation, and continue the discussion on this very, very important topic. So thank you again for joining us. We hope to see you at our next Leading Edge event. We have 4 of them a year. I think there are 4. and they are great. And they are on a host of different topics, all healthcare related. And the next one is November 7th with Doctors Patrick White and Nathan Moore, who are leading voices in the palliative and hospice care area. So it's going to be a very, very interesting discussion, and bring your friends along with you. So if you can stay a little longer now, we have refreshments and drinks and so forth, and we hope you have a wonderful evening. And thank you, Deidre, for educating us on what I think is just part of our philosophy and our future that is so important to everyone. Thank you.